Welcome to the deep dive. So, picture this. You've planned that amazing trip to Vietnam, everything's booked, bags nearly packed, but then you get that little niggle. What about your medication? Can you even bring it? What if you run out mid-trip? Well, today we're diving deep into something absolutely crucial for anyone heading to Vietnam, whether for a short visit or a longer stay, dealing with medication. And this isn't just about ticking boxes, it's really about staying healthy, safe, and actually enjoying your time there. We're aiming to cut through all the confusion, give you the practical insights you need, and we'll uncover some surprising things that could genuinely save you a lot of hassle, maybe even prevent a real crisis. So our mission today is pretty straightforward. We're breaking down exactly how to bring your necessary meds into Vietnam, what you can actually find locally if you need to buy something, what to do if you find yourself in a pinch, maybe you forgot something vital, and of course, the really important regulations you just have to know. Because honestly, what's tucked away in your toiletry bag could potentially cause big problems, or just as easily be exactly what you need in an emergency. Now, this deep dive was brought to you by ProCare Hanoi. They're the phone and laptop repair shop that the expat community really trusts. Look, when your tech decides to act up, maybe you're tracking prescriptions on an app or trying to book a clinic appointment and you need help fast. You need clear communication, honest advice, and that's exactly what ProCare Hanoi provides. They've been helping expats out with solid, speedy service for, over 15 years now. And on a personal note, this show really is a labor of love for us. If you found any value in these deep dives we put together, I'd be so grateful for your support. Buy me a coffee is probably the simplest way to just say thanks. And trust me, every single contribution genuinely helps keep the lights on and keeps us exploring these topics. You can just scan the QR code right there in the podcast cover art. And for those of you who've already chipped in a massive heartfelt thank you, you really are fueling this whole journey.
It's true. And fundamentally, our goal today is to give you the knowledge, the confidence, really, to manage your health safely while you're abroad. What's often surprising, I think, is just how much stress a little bit of simple, upfront planning can eliminate when it comes to health matters in a new place. It's not about being paranoid, it's just about being smart, prepared.
Okay, so let's unpack that first big question, the one that probably jumps into everyone's head. Can you actually bring your prescription medication into Vietnam? And the short answer, based on everything we've seen, is yes. But, and this is a really big but, it comes with a pretty significant warning label attached. It's very much a yes, but be extremely careful.
Right, and here's where it gets, kind of eye-opening, especially for travelers from, say, North America or Europe. Some medications that are super common, prescribed all the time back home, they're actually strictly regulated here, or even classified as controlled substances, sometimes even banned substances in Vietnam. And yes, that's true, even if you have a perfectly legitimate prescription from your own doctor. We're talking about things like painkillers containing codeine, that's a common one, or ADHD medications, like Adderall or Ritalin.
Right.
Even some anti-anxiety drugs, Xanax, Valium, things like that. I mean, these are everyday prescriptions for so many people, yet bringing them in without the right prep, that could lead to serious issues. That is precisely the critical point. What feels completely routine and is easily accessible in your home country might fall under very tight restrictions or even require specific prior permissions in Vietnam. It really throws a spotlight on how different national pharmaceutical regulations can be. It's not just Vietnam, of course, but their rules, particularly around opioids, stimulants, and certain psychoactive drugs, can be quite strict. It stems from different historical contexts, different public health approaches. Just understanding that basic difference, that normal for you isn't universal normal, that's the first essential step.
Okay, so knowing it can be a bit of a minefield, what should you do? What are the practical, concrete steps to take so you don't, run into trouble at customs? First up, absolutely non-negotiable. Always bring a physical copy of your doctor's prescription. And here's a really useful tip we found. Make absolutely sure it lists the generic name of the drug.
Yes, that's crucial.
Not just the brand name you buy it under. Brand names change everywhere, but the generic chemical name. That's usually universal. Second, keep all your medication in its original, clearly labeled packaging. I know it's tempting to use those little pill organizers, but don't. Customs needs to see what it is, and the original box confirms it.
Right. Resist that urge.
Third, if you possibly can, get a letter from your doctor. This is especially important if you're carrying opioids, stimulants, or antidepressants. The letter should just briefly explain your condition and why you need that specific medication. It gives context.
Essential context.
And finally, and gosh, so many people learn this the hard way, always pack your medications in your carry-on bag. Never, ever put them in checked luggage.
Absolutely.
The risk of lost bags, delayed flights, it's just way too high. You cannot risk being separated from essential meds.
And you touched on something important there, the quantity. That supply limit often catches people out. It raises an important question, really. Why are there such strict limits on how much you can bring in? Well, it's mostly about preventing illegal trade, diversion of drugs, but also about ensuring there's some medical oversight, even for personal use. Vietnam, like many countries, wants to control what comes across its borders. So the key takeaway here is, generally, don't bring more than a 30-day supply, maybe 60 days for some things, unless you've actually registered properly with the Vietnamese health authorities beforehand. Trying to bring in large quantities can definitely trigger red flags at customs.
Yeah, leading to questions, delays, maybe even confiscation. Not worth risk. Okay, so let's shift gears slightly. Let's say you've successfully navigated customs, you're in Vietnam with your initial supply. All good. But, you run out. Or maybe you pick up a common travel bug and need something. How easy is it to just buy medication locally? Well, the good news is Vietnam has pharmacies everywhere. Seriously, especially in the bigger cities like Hanoi, Ho Chi Minh City, Da Nang, you'll see Na Thuc signs on practically every other block. And what's quite convenient, actually, is that a lot of calming medications are available over the counter. You don't necessarily need a prescription for things you might need one for back home. You can usually get hold of basic antibiotics pretty easily, like amoxicillin, standard painkillers, ibuprofen, paracetamol, no problem. Anti-allergy meds like loratadine or cetirizine, widely available. And various stomach remedies, things like omeprazole for heartburn or Smecta for digestive issues, those are common staples. So for minor stuff, you're generally okay.
What's really interesting here is that accessibility. It's quite remarkable, but, and it's a significant but, it does come with some really crucial things to watch out for. You absolutely need to be aware of these caveats. First off, while the drugs might be available, the brand names will almost certainly be different. Trying to ask for your specific brand of, say, cold medicine probably won't work if you don't know the local equivalent name.
Right, that could be tricky.
Dosages might also be different. You've got to pay really close attention to the strength, the milligrams of whatever you're buying. Don't just assume it's the same as back home. Then there's the language barrier. Especially in smaller independent pharmacies, there's absolutely no guarantee the pharmacist will speak English. Communication can be a real challenge. And, well, a slightly less comfortable truth that our sources point out. In some of those smaller shops, the ones maybe off the main streets, things like expiry dates and storage conditions can sometimes be questionable. Meds sitting out in the heat and humidity. That can really affect how well they work. So you need to use your judgment.
So what does all that mean for you, practically speaking?
Well, the advice we got, especially from expats who've lived there a long time, is pretty clear. Try to stick to the big, reputable pharmacy chains. You'll see names like Long Chow, Fano, or Guardian. They tend to be much more reliable, better stock control, proper storage, more likely to be authentic.
Definitely.
And crucially, you stand a much better chance of finding staff who speak some English and can actually help you properly. It might mean walking an extra block or two, but it's usually worth it for peace of mind.
Absolutely agree. Consistency and reliability matter there. Okay, now let's tackle a scenario that's probably every traveler's mini nightmare. You've done everything right, you brought your meds, maybe you tried to find a local replacement, but you still run out of something crucial. Or maybe you just completely forgot to pack something vital. What do you do now? Don't panic, there's a plan. Your first move, the immediate step, should be to get yourself to a major international clinic or hospital. Think places like Vinmec or Family Medical Practice or Raffles Medical. They have branches in Hanoi and Ho Chi Minh City. These places are specifically geared towards foreign patients. They usually have excellent English-speaking staff, Western-trained doctors sometimes, and importantly, they can assess your situation and prescribe suitable equivalents for your medication.
That's key. They understand foreign prescriptions.
Exactly. And when you go, make sure you bring whatever documentation you have. Your original prescription, if you have it, any doctor's letters, maybe a summary of your medical history, even just the empty packet of your usual meds. All this information helps the Vietnamese doctors understand what you need and find the best local alternative for you. They're generally very good at finding appropriate substitutes.
And this really highlights the need for flexibility. If we connect this to the bigger picture, it's about managing your expectations and frankly, trusting the local medical professionals, your exact brand from home. It might simply not exist in Vietnam. That's okay. The key is being open to the local doctor's recommendation for a generic version or a therapeutically similar drug. These doctors know their stuff. They know what's available and effective locally. It sometimes means letting go of that attachment to a specific brand, which can feel weird when it's about your health, but it's often necessary.
Yeah, that reminds me of a really great story from one of our sources. An expat traveler, she was really quite upset because she couldn't find her specific migraine medication from the US anywhere, a brand she'd relied on for years. So she went to an international clinic in District 1 in HCMC, explained the situation, showed them her old prescription, and they prescribed a Vietnamese-made equivalent.
Okay.
And here's the kicker, the real aha moment. She said it actually worked even better for her than her original US medication.
Oh, wow. That's fascinating.
Right, so sometimes being nudged towards a local alternative can actually lead to a surprisingly good outcome. It's a good reminder that different doesn't always mean worse.
That's a fantastic anecdote. Really illustrates the point about adaptability.
Okay, let's shift now to the fine print, because this is where things can get really interesting and honestly, potentially quite risky if you're not paying close attention. We need to talk about some pitfalls and definite red flags. And here is a massive one. A huge warning. Don't ever try to mail medication to yourself in Vietnam without meticulously, absolutely checking the rules first. Just don't do it casually.
Oh, definitely not. Big mistake.
It's such a common thing people think of doing, maybe asking family back home to send something over, but it can have serious consequences. Vietnamese customs are very likely to confiscate it, maybe even destroy the package. This is especially true if it contains any kind of controlled substance or if it arrives without the proper documentation. We've heard stories people desperate for meds, package gets stuck in customs for weeks. It causes immense stress.
And it's not just stress. It can become a legal issue.
Exactly. It's not just an inconvenience. You could face fines, legal hassles, and obviously you still don't have your medication. Don't risk it.
And this really gets to the heart of navigating bureaucracy internationally. It's not just about what's legal for you to carry. It's about what's permitted to be imported officially through the mail system. A lot of medications, especially things for mental health, sleep issues, serious pain management, they often require specific import permits. You need to get that permit before the package is even sent.
Right.
The system is there to control what comes into the country and trying to sidestep it, even accidentally. That can land you in hot water. They take drug control very seriously.
Another area to be mindful of, something easily overlooked, is travel insurance. It's great for emergencies, obviously, but it very rarely covers issues related to pre-existing conditions unless you've specifically declared them.
That's standard.
And probably paid extra for that coverage. So the advice is always, always scrutinize that policy fine print before you travel. Understand exactly what is and isn't covered regarding your specific health situation. Don't make assumptions.
Yeah, assumptions with insurance can be costly.
So, boiling it down, what are the absolute must-have documents you should carry with you besides the pills themselves? You need that original prescription, clear name, doctor's info, generic drug name. It's also really smart to carry the medication leaflet, the insert that comes in the box.
Yes, the patient information leaflet.
Right. That has detailed info which can help customs or a local doctor identify the drug and its purpose. And if you can manage it, especially if you're staying longer, getting a simple Vietnamese translation of your prescription and your condition, that can be incredibly helpful.
It just removes any ambiguity in a potentially stressful situation.
Definitely.
And what's really fascinating here is how simple everyday technology can become such a vital tool for your health and safety when you're traveling.
Yeah.
Here's a really practical tip for communicating with local pharmacists or clinic staff. Use Zelo. That's the big messaging app everyone uses in Vietnam.
Yeah.
Or just plain old Google Translate on your phone.
Oh, yeah. Good point.
Think about it. You can type in, "I need medicine for high blood pressure," translate it, and just show your screen. Or take a screenshot of your medication label, translate the key bits. Even just showing the name of your condition translated can bridge that language gap so quickly and effectively. It's a simple thing, but it can make a huge difference.
That's a brilliant tip. Using the tech you already have. Okay, so beyond just the rules and the what-if scenarios, let's talk a bit broader now about general health smart practices for travelers who are carrying medication. Because, managing meds while traveling isn't just about regulations, it's also about staying well in a different, often quite dynamic environment. First off, and this is huge in Vietnam, stay incredibly hydrated, drink lots of water. The heat and humidity there can be really intense, and dehydration can actually make medication side effects feel much worse. Think dizziness, fatigue.
Absolutely crucial. Hydration is key.
Second, Try to avoid self-medicating with unfamiliar brands or dosages, even if they're easy to get over the counter. Just because you can buy something doesn't mean it's the right or safest choice for you. If in doubt, see a doctor or pharmacist at a reputable place.
Good advice. Stick to what you know or get professional advice.
Third, think about how you store your medicine, that climate we mentioned. It means you probably need to keep your meds in an air-conditioned room or maybe in a sealed, airtight container. Heat and humidity can seriously degrade many drugs, making them less effective or even unsafe.
Yeah, protect them from the elements.
And finally, a simple but vital one. Always keep emergency contacts easily accessible. Have them written down in your wallet, clearly marked IC in case of emergency, and have them programmed into your phone, of course. Include family, friends back home, but also the contact details for your embassy or consulate in Vietnam.
This all really feeds into a broader idea of, let's call it holistic preparedness. It's not just about the physical items you pack in your suitcase, but about your overall approach, how you adapt to the environment you're in.
Sure.
Being proactive about your general well-being, staying hydrated, like you said, being careful with food, avoiding unnecessary risks. That mindset can actually prevent many situations where you might need urgent medical help in the first place. It's about building resilience.
That's a great way to put it. So for listeners who might have chronic conditions or just want to feel super prepared, let's quickly summarize a practical packing checklist based on everything we've covered. 1, bring your full supply of essential medication, plus maybe a few extra days worth delays happen.
Good buffer.
2, pack multiple copies of all your prescriptions. Keep them separate, maybe one in your carry-on, one in your wallet. 3, consider carrying a small card with your key medical conditions clearly translated into Vietnamese. Could be invaluable in an emergency if you can't communicate.
Smart. Very smart.
And 4, before you even leave home, look up and save the contact information for reputable international clinics in the cities you'll be visiting. Program their numbers into your phone.
Pre-planning those contacts is key.
Absolutely. Look, traveling with medication in Vietnam, it really doesn't need to be a source of major stress or anxiety. Honestly, with a bit of planning beforehand, a good awareness of the local rules, and knowing where to turn if you need help, you can stay healthy, stay safe, and be totally ready to enjoy everything that amazing country has to offer. It's really about empowering yourself with the right information.
Exactly. And that maybe leads us to a final thought for you, the listener, to perhaps chew on. Beyond just medication, what other seemingly small preparations or even just shifts in your mindset could dramatically boost your safety, your well-being, and ultimately your enjoyment when navigating an unfamiliar culture? It's an interesting question to consider as you plan any trip, really focusing not just on the what of travel, but the how you approach it.
Great point to end on. And remember, this deep dive was brought to you by ProCare Hanoi, trusted by expats for fast, reliable phone and laptop repair since 2009. Seriously, whether you're managing prescriptions on your phone or booking clinic appointments online, you need your tech to work reliably. ProCare helps keep it that way. Thanks so much for joining us on this exploration today. We genuinely hope this information helps you prepare for your next journey, wherever that might be. Keep exploring knowledge with us on future deep dives. Stay safe, stay smart, and we'll see you next time.